So when we talk about keeping fit and staying healthy in order to prevent the resurgence of certain non-communicable diseases, Maggie, do you think that the pandemic has made Malaysians perhaps more aware of their health? And have there been any behavioral changes that you've observed of the fitness habits of your clients?
Well, absolutely. Well, first of all, I think people in general, Malaysians, are a lot more aware about the importance of having good physical health, right? And according to Prioritise, which is a discount aggregator, they revealed a 45% increase in interest in workout videos and podcasts just during the MCO alone. So while it is very on demand, workout videos are not revolutionary. That's nothing new. It has been around for years, but because right now I think it's just a lot more fitting to the situation, to the climate, that it's a lot more accessible to have virtual workouts, that people are getting onto it. Having virtual workout, they can keep themselves sane, especially staying home so much, working from home from morning till night and not having anywhere to go. So to answer your question, I definitely have seen an increase of people being a lot more conscious about physical health in general, for sure.
But I guess the question here would be, is the surge in demand in participants, say in virtual classes, would you say this is just as a result of gyms being closed, or are these new participants who are perhaps now more aware of their health and fitness habits?
Well, I would say a little bit of both. I can't speak on behalf of them, but what I do notice and observe from our group of members that has been joining Motion Lab, which is the fitness studio that I own, that we provide small group classes and personal training as well. So during the MCO period, RMCO, CMCO, we have been providing virtual workouts. And we have noticed the behavior and the type of people that have been coming on. And most of them, I would say at least half of them, never usually actually work out in general before the MCO happened. It was never their priority. But because of what's happening right now, there has been a shift in their habits, their priorities, which I think it's not all bad. The fact that people are a lot more aware with COVID-19 happening. Okay, I need an insurance. Okay, I need to be more active. Okay, I can't just stay home the whole day. I need to make sure I work out so I stay healthy. So I think in that sense, I think it's good.
So the question now, of course, is that, as Malaysia moves into a recovery period, as we're starting to see the economy restart, perhaps people going back to their regular jobs, how do we keep the momentum going in terms of that awareness of the health and fitness benefits of just things like exercising regularly? Eric, perhaps you could weigh in here on this from a prudential standpoint, because you mentioned fitness trackers, for example, as one of the elements of the Pulse app. How will these technological innovations help to push this ball forward?
Yeah, I just want to say that first and foremost, it really is within ourselves whether we want to take the action part, right? I think we spoke at great length around the action, which is sort of, we can give the resources, we can give the information, but people need to kind of take the action. And it's kind of innate in you. You have to really want to do it. So I'll just start by saying that our role is a facilitator. As one who provide the resource. So it's true that via PALS, we've got the ability to use the activity tracker. And we've got that for walking, running, swimming, cycling, just to name a few. And really, I think I want to speak to what Maggie talked about earlier as well. I think it, during this period is really time where we start. So the encouragement is, if you haven't started, why don't you start? So personally, I've been sort of doing walks around my neighborhood, 5 to 8 km a day, make time for it, perhaps early in the morning, late in the evening when, you're done with your work, right before dinner, perhaps. Start to use these resources, right? We've also got resources within PALS by Prudential for health assessment. I just heard that, not many of Maggie's followers are actually kind of doing health assessment. So we've got the resource actually. It's within the PALS app that you can start health assessment. And that's also something that we've actually spent a lot of time doing. We've also got a symptom checker where you may want to check on certain symptoms that you've been experiencing. So Those are all available within the Pulse app. And I just want to add that, you know, our role is pretty much exactly that, right? Is to really do the prevention bit, to start people off caring about their own well-being, their own health. But we also have not forgotten about the prevention bit, of course. We do have a special COVID-19 coverage that is administered through the Pulse app, where Malaysians, whether they're Prudential customers or not, can sign up for free COVID-19 coverage. And Prudential is one of the first few companies that have actually started the additional coverage. We see that Malaysians are taking actions, and that's a good thing, but we need more. We're really encouraging everyone to really start your personal health journey.
Yes, because the tools are there. It's up to you to pick it up and carry it forward. So, Dr. Faisal, from the Health Ministry's standpoint as well, you know, what can we do from a policy and regulatory standpoint in order to keep the momentum going in terms of Malaysia's changing health culture?
This promotion of healthy lifestyle, to be physically active, to eat healthily, not to smoke, not to drink alcohol, that's an ongoing program. And when you talk about changing behavior, it is a complex issue. It is a combination of your internal, what you think is important, prioritization. However, at the same time, you need an environment that supports the changing of the behavior as well. Just to bring back the discussion to COVID-19, I think Malaysians are a peculiar lot now. We stop wearing masks. We don't care about physical social distancing now. That is what I'm personally observing. And that's what's being reported in the news as well. That prompted perhaps the Prime Minister to make a special plea yesterday. So coming back to this issue about healthy behavior, health campaigns is very important to raise awareness and knowledge, and it is an ongoing effort. I see digital health tools as tools that provides an alternative to help people on their journey of changing behavior. All right. However, as tools, there are limitations to these tools. Okay. So one of the key limitations is, like, I'm wearing a wearable right now. Wearing a wearable does not make me want to wake up in the morning to go for a run. All right. If I'm not active. Okay. It will help me if I've made that decision to change my behavior. Yes, then there are many tools out there. Apps, there's so many. But this will only appeal to those who are, in a way, converted. Then how do you convert those who are not converted, who are not even interested to listen or even to view videos? And that's a question that is not easy to answer. One of the key things perhaps is the normalization of this healthy behavior. What's normal for us now is unfortunately not the best for our health. You know, the question kan, jumpa kawan, sudah makan? So, you know what I mean? So basically it is culture, but culture can be changed. We've seen culture change in Malaysia, but towards the negative. For example, I was watching a documentary several years back. Do you know that when about the Middle Eastern food, there was only 2 restaurants in Bukit Bintang when it first started? And now you will see a restaurant Nasi Arab even in a small town. And everybody knows Nasi Arab. You know, that's not our food culture, but it has incorporated into our culture. So culture can be modified. Unfortunately, we're seeing it in the wrong position. So how do you change culture? That's a very good question, a separate discussion altogether. But what I think is important as a parent with young children is to advocate for us to be good role models. Children learn from not what we say, but from what we do. And I think it is the opportunity for us to change. Perhaps melentur buluh biar daripada rebungnya, and you can't teach old dogs new tricks. So perhaps I'm saying people like me, dah tua ni kan, tak payahlah buat education, cakap apa pun tak guna, tak dengar pun. Kan, they still want to drink their, you know, their sweet drinks, teh tarik, whatever. So I've sort of given up lah. I've got my colleagues also cakap pun tak guna, and they are doctors, you know. So perhaps, and they know who they are. But, you know, it is an opportunity because behavior is inculcated at the young, you know, you inculcate your habits during the young. So my message would be, as parents, you have a responsibility to be a positive role model, being physically active, not to smoke, if you're smoking, being mindful eating, not just healthy eating, mindful. You know, there are many components about eating, right? It's not just about the food that you eat, thinking about the quality where the food is sourced. Yeah, I'll stop.
But I guess all is not lost for those of us older dogs who are quite set in our ways, myself included, because I guess, COVID-19 has really upended our existing habits. So the question now is, how do you make that conscious decision to carry those habits forward, even as we return to some semblance of normalcy? I mean, that's going to take time and effort on yours and my part, but at the end of the day, that's time and effort invested towards our health.